Hello and welcome. You're watching this special broadcast on NDTV. My name is Sonal Mehrotra Kapoor. Now, the COVID-19 pandemic has positive, negative impacts on different aspects of lifestyle behaviors. Negative lifestyle behaviors are associated with an increased risk of adverse outcomes that we saw because of COVID-19. And while dealing with COVID, we overlook the fact that people's lifestyles were severely disrupted. Or perhaps did we underestimate it to a very large degree? Many people have become physically inactive, developed irregular eating patterns, which leads to unhealthier lifestyles as well, and aggravated the lifestyle-related diseases. COVID-19 pandemic has also caused significant changes to homes, work, life, stress levels as well. And thus, a multi-sectoral approach promoting healthier diets, increasing physical activities is the only way forward that can help in slowing down what is now being called a diabetic epidemic of heart and also of heart diseases in the country. Now, Beat Diabetes, Myths and Facts. This is the program that we're doing today, which will impact and we hope will help a large number of people to prevent and control these metabolic disorders. Today, we have with us experts who will be taking us through their advice and expert opinion on what to do in this regard. Joining us today is Dr. Sen Purkayastha. He is MBBS DND, MDRC from Madras. He's a diabetologist at the Mediland Diabetics Clinic in Silchar. Thank you so much for your time. Dr. Sen, we have Dr. Krishna with us, Dr. P. Krishna Prasanthi. She is MD, Senior Consultant Physician and Specialist in Diabetes Management in Tirupati at the Harshita Hospital over there. Welcome to the program, ma'am. We also have with us Dr. Sanjeev Gupta. He's MD Internal Medicine. He's also DM Cardiology, Senior Consultant at the SDMH Heart and Diabetic Clinic in Jaipur. Welcome all of you to the program, and let me first take the question to Dr. Sen. Dr. Sen, do medicines that are basically used to treat viral infection caused in some way hyperglycemia or high blood sugar in people, if as has been reported, and if yes, then after getting cured of the infection, do blood sugar levels come back to normal, or do you think it continues? And what is the best way perhaps to fight this? I know it's a loaded question, but please take a go at that.
Steroid is being used for the treatment of viral infection like COVID-19 in the OPD, in inpatient and in ICU setting, leading to rise in blood sugar. Generally, it comes down in few days after withdrawal of steroids. In a few cases, steroid treatment has exposed the latent diabetes. Dose of anti-diabetic medication requires up titration, and in a group of patients, even addition of insulin or analog is required in OPD treated cases. Mental stress do contribute to the rise of blood sugar during this pandemic.
Let me take the next question to Dr. Krishna there. Dr. Krishna, recently studies have shown that COVID-19 patients with diabetes had a poor prognosis and a higher mortality rate as well. Why is it so, and what can people do to reduce their risk of adverse outcomes as well?
Yeah, because this pandemic, what we are learning is now we are exposing to the dual pandemic of diabetes and COVID-19. Per se, diabetes is a state of an inflammation where the immunity is getting less and there is an increased entry of the virus into the body and there is more risk of the complications. In diabetics, what we have seen is there is increased morbidity, increased mortality, increased stay of patients in hospitals and ICU, more risk of complications, longer duration of exposure to the steroids and other drugs. So what we want to do to decrease the complications, number one is all existing diabetics should have a good metabolic profile control, that is the control of the blood sugars, control of the blood pressure, control of the lipids. The second thing is a regular physical activity will definitely decrease the blood sugars, increases the insulin levels, and will definitely decreases the risk of the blood clots in the body. The third thing is a well balanced, healthy, immune boosting diet is very, very important because patients are taking high carbs, high fats, and which increases the risk of the increased blood sugars in the body and again going for more metabolic complications. So, to decrease the complications of COVID in diabetics, we need to have a well balanced diet, well balanced exercise, well balanced treatment, well balanced medication.
All right, a lot of balance there needed. How many of us, after knowing all of this, actually managed to do that is the question. Let me take the next one to Dr. Sanjeev Gupta. Dr. Gupta, there are increasing instances of people having encountered fatal heart attacks as well post-COVID-19. It is a side effect as well. Is it really of COVID infection, or is it just a myth that COVID-19 can cause heart attacks?
It's very true that the incidence of infarction, myocardial infarction, is slightly elevated in patients who have had COVID. But it is not COVID per se which causes the problem. It is because it's an inflammatory disorder. It causes a prothrombotic state. Most of the patients who have COVID are elderly patients with multiple associated comorbidities like diabetes, hypertension, obesity. COVID itself resulted in a lot of sedentary lifestyle and unfold eating habits. And because of the multitude of these factors, the patients of COVID who have the worst presentations, who present with cytokine storms, who have metabolic disturbances, who have abnormal BPs and pulses, this results in plaque rupture, and it is these patients who present with myocardial infarction. However, isolated COVID itself causing myocardial infarction in the absence of these predisposing factors would be unlikely.
Right. So that's a good clarification to get there. Let me take the next question to Dr. Sen there. Now, working from home, Dr. Sen, is convenient. A lot of people are fighting for it as well. But people are working more than regular working hours. Isn't that right? They are neglecting medicines also due to the work stress. What should people really with diabetes know about adherence to medications during the pandemic?
Working from home, study from home is the concept used during this pandemic, which has led to reluctance in diabetes management. Diabetic patients should go for indoor exercise, pranayama, keep the prescription and medication in a prominent place in the house which attracts eyes. Use mobile alarms to remind about the intake of medication, diet, etc. This will increase adherence to diabetes management. Negligence in doing exercise, improper diet, irregular medication only lead to increase in blood sugar, disrupting the diabetes control. So people must be very, very careful in planning the exercise, the dietary timing, and medication. This will help in controlling the sugar.
All right. So do pranayam and all is a good takeaway from what Dr. Sen said. Dr. Krishna, then when societies went into the COVID-19 lockdown, the conditions under which people with diabetes managed their illness dramatically changed, right? Like some of them tried to keep their lifestyle healthy with diet, exercise, but due to work from home, their sleep pattern also got disrupted in a way. Can this disrupted sleep pattern, and this is what a lot of us are very interested in, can actually alter blood glucose levels?
Yeah, actually, there are two parts of the question. In the COVID pandemic, because of the lockdown and everything, and because of the work from home and everything, there is totally change in the pattern of the sleep, pattern of the diet, pattern of the working hours. And if you see that there are the two classes of the people, one is the diabetic patients per se, where NRIs or software engineers, where they used to work in a different hours and a different sleep pattern. The other is the homemaker or housewives who used to take care of these persons, supplementing on the taking care of the food food and everything, her sleep pattern is also disturbed. Actually, now the research says that definitely the sleep is going to have the impact on the blood sugar levels, because our body is tuned to the circadian rhythm of the hormones because of the increased secretion of different varieties of hormones like cortisol at the earlier hours. If you are not sleeping adequately, if you are not having a very good sleep, if you are not having a good quality of sleep, and if you are having a disturbed sleep, definitely it is going to have impact on the blood sugars. It will increase the blood sugars. You have the high fasting blood sugars. The other side is, because of the high blood sugars, because of the increased urination in the night time, the sleep pattern is getting disturbed. So again, this is a vicious cycle that definitely sleep hygiene is an important new concept which we have to advocate for the healthy living lifestyle, more so for diabetics. A good quality of sleep, at least 6 to 8 hours, is mandated, at least in the post-COVID recovery patients, for good control of the blood sugars.
I see, but what about non-diabetics, ma'am? People who have sort of weird working hours. It could be not just us in the media, but several other people as well. Do you prescribe having set sleeping patterns as a way forward?
Yeah, definitely, because untimely food, untimely sleep, and the shifting duty patterns, working for the late hours is definitely going to have impact on the health of the patients, more so on the blood sugars. That is going to increase the stress, increase the adrenergic hormones. Again, it will increase as the blood sugar. So, if you don't want to be a pre-diabetic, if you don't want to be a diabetic, you should have a good healthy lifestyle patterns, more so for your sleep and diet.
All right, let's take a moment to absorb that, and let me take a note of that first stuff along with my colleague. Let's take a break on that note. We'll be back in a moment. Welcome back. We are discussing what exactly is the impact that the pandemic has had on your health, particularly when it comes to diabetes and heart diseases. Let me take forward this conversation with Dr. Gupta. Now, Dr. Gupta, people survive a first heart attack but are at increased risk for another one, as is often being said. What precautions do you think they should be taking to reduce chances of a second attack?
I think that there are two parts to the story. First is that you should save yourself from the first heart attack, which means that it needs to be treated appropriately. And if it has been treated appropriately by medical or angioplasty or bypass, the second step is to prevent recurrence. So if patients have not been treated appropriately in the first step, in those patients, recurrence will be higher. In patients who have been treated correctly, then it goes to managing of risk factors and medications. So the classical risk factors which promote recurrences: hypertension, diabetes, dyslipidemia, obesity, smoking, sedentary lifestyle, and chronic kidney disease. So patients need to be told very strictly that they have to quit smoking, they have to reduce weight, they have to control their diabetic blood pressure and cholesterol status. And this has to be done by defined parameters which are very, very clearly laid down. So good glycemic control, everything has to be controlled by lifestyle modification, by diet, and by medical supplementation. So most patients who have had a heart attack would need something medicine like aspirin or clopidogrel. They would be on a lipid-lowering drug, which is commonly known as a statin. They would be on a beta blocker drugs, which helps in preventing recurrence of infarction, controls angina and heart failure. They would be on drugs to modify the left ventricular function, that is generally an ACE inhibitor or an ARB. So if you go for regular follow-ups and are able to control all your risk factors in a correct manner, then you would decrease the chance of recurrence of events in the years to follow.
All right, Dr. Sen, let me come to you next. Is only blood sugar control sufficient for the effective management of diabetes? And if not, what other factors should really be looked at?
Now, diabetes can invite or remain associated with multiple problems. So, only blood sugar control is not sufficient. Detection and management of ischemic changes of brain, heart, foot, retinopathy, hypertension, lipid levels, fatty changes of the liver, pancreas, nephropathy, neuropathy, urinary tract infections, and other infections, including fungal infections, diabetic foot problems must be considered in the effective management of diabetes. So, we have to see the patient as a whole and go through the problems of the patient. Along with control of sugar, if we can keep other parameters within normal range, then only we can control the diabetes, prolong the life of our patients, and help them to lead a healthy life.
Dr. Krishna, let me come to you next. Why does blood sugar level actually go up when someone does a physical activity? What precautions should people with diabetes need to take to manage blood sugar as well levels along with their workout regime?
No, actually, normally we say is when you're doing your exercise, your blood sugars are coming down. But in type 1 diabetic children, where there is no secretion of the insulin, if you start going exercise, there is no good metabolic smooth control of the blood sugars. Sometimes you see the sudden surgeon of the blood sugars. So at this point of the time, we have to see what is the weight of the child, what is the daily insulin requirement, what is the type of the physical activity they are going. Are they going for a regular activity or any additional sports or games activities? Then we have to adjust the dose of the insulin and we have to give some snack supplementation depending on their profile. Normally in type 2 diabetics, what you routinely advise the physical activity, elderly people, long-standing people, where they have a high fluctuation of the blood sugars like a brittle diabetes, we advise them to take a simple snacks or a tea with biscuits when they are going for a regular walk or like that. But if the patients who are athletes are going for a strenuous sports activities like that, they have to be a very good metabolic profile or a time in range has to be assessed, and we have to give the snacks or the previous dose of the insulin and oral anti-diabetic drugs to adjust the blood sugar levels. Normally, we say for any elderly people or any patients who are on dialysis or a chronic cardiac patients, they have to take some snacks or a light snacks before going for any regular physical activity like walking or jogging or swimming.
I see. That's important information out there. Let me move to hypertension now and get in Dr. Sanjeev Gupta over there. Does hypertension, Dr. Gupta, increase the risk of heart disease, heart attacks in individuals? And while that might be a no-brainer really, what really needs to be understood and what can be done to manage hypertension, thereby and reducing the risk, especially if it's running in your family?
Okay, hypertension does increase the risk of coronary artery disease. Hypertension is one of the most silent killers for coronary artery disease, but it is more commonly correlated with stroke. The preventing measure is that one should get the blood pressure checked, and anybody between the age 18 to 65 who has a blood pressure of more than 140/90 would be labeled as hypertension. And if somebody has blood pressure, then one needs to control blood pressure and get the blood pressure down to parameters which is less than 140/90, though the target for blood pressure depends on the age. Younger people, less than 65, one would want a systolic blood pressure less than 130 and a diastolic blood pressure less than 80. You need to also associate whether blood pressure is associated with other comorbidities, whether it's associated isolatedly or it is associated with stroke or with CKD or with CAD. And depending on the associated comorbidities, they have to be appropriately treated with the drugs which are appropriate for a particular. So there are multiple drugs which are very safe. And if the medicines are taken in the appropriate dosages with a good clinical follow-up, then the blood pressure can be adequately controlled and that decreases the chance of subsequent cardiac events.
Thank you all for joining us, to Dr. Sen, Dr. Krishna, Dr. Sanjeev Gupta. Thank you so much for your time. That's all we could pack in this episode. Thanks so much for watching. Bye-bye.